Welcome, friends. Welcome to my home. If you were here in person, we could have a cup of tea and a chat. Today, we'll settle for the chat. I'm Ophelia Dahl, a co-founder of PIH, or as Paul called me, and many of you, sunshine, sweetness and light, if the request he was about to follow it with was really big, or most often, just men. As we gather to mark the first anniversary of Paul's death, it's good to be together. We mourn with Paul's dearest, his wife Didi and their children, Catherine, Elizabeth and Sebastian, and his mother, Ginny, and his siblings, Katie, Jim, Jeff, Jennifer and Peggy. We're not here to remember Paul, for no one who met him, even once, could ever forget him. We gather to celebrate Paul's extraordinary life, our shared transformative work, and Paul's expansive and irrepressible vision of high-quality care for everyone. Colleagues and friends from around the world are here to share their reflections and to remind us to keep on keeping on. We'll spend an hour together with a bit of music and visits from many parts of Paul's life. We're recording this, and we'll share the recording afterwards so you can watch it again in the future. If you would like closed captions, you can access them by clicking CC at the bottom right-hand side of your screen. And now, our first word rests with Didi Bertrand Farmer. Didi needs no introduction, but I'll note that her work to support girls and young women is PIH's in microcosm, identifying, even within a setting of enormous need, the most vulnerable, and designing systems to support not just their survival, but their thriving.
It is the spirit of remembrance and solidarity that brings us here on this day of February 21st, 2023, to mark the first anniversary of our beloved Paul's sudden passing. Throughout the past year, the global community he faithfully served and inspired has joined his family, closest friends and partners to grieve and mourn his profound loss and celebrate his remarkable life in so many ways. His long-lasting impact has never felt so vivid and profound. In looking back at specific ways he has impacted the world, what stands out the most are his intense energy, passion, dedication, and love in bringing people together and building bridges within and between countries and institutions, as well as his extraordinary ability to serve and advocate for the rights and dignity of the poorest and most marginalized. And I will always appreciate the nature of this commitment that shapes this collective impact over 30 years now. If Paul could have talked to us about ways he would like to be remembered, I think it would be through action. He would want us to keep pursuing the social justice and health equity mission for maximum impact and double down on the mission, which he reminded us is not optional, but essential. I take great comfort that through our collective commitment and actions, Paul's life is infinite, as we are holding on tight to the thread of this global movement with our daily actions that count. How I remember my beloved Paul today and every day is in the way we accompany each other to deliver on his promise and hold on together to the thread with greater hope, passion, energy, and love. On behalf of our 3 children, his extended family, and the broader Partners in Health community, I express my deepest gratitude to all of you who have joined this morning to celebrate the remarkable life of our remarkable and beloved Paul. Ensemble, n'a avancé. Onward, together.
Merci Didi, c'est vrai, ensemble n'a pas avancé. As all of you know, PH's work stretches across 4 continents. Valeria Macías, who is a mentee of Paul's, like many of you, and like all of us really, leads our work at Compañeros en Salud in Chiapas, and she joins us now from there.
As a young physician growing up in Mexico, I remember feeling that something wasn't right. When I was doing medical school and rotating through hospitals, I just kept feeling that the way we practice medicine wasn't the best one, or it just didn't feel right. So I remember when I applied for Partners in Health for the first time, I've never heard of this organization or anything that was happening around the world. But as I started to work as a rural clinician, it really changed the way I practice medicine. Partners in Health and all the teachings of Paul Farmer helped me to see medicine through a different lens. It was the social medicine and accompaniment lens. And it taught me the importance of closeness to our colleagues, closeness to our works, but more importantly, closeness to all the patients, to every and absolutely person we see in our day-to-day work. It helped me to learn the importance of being close to people, going the extra mile. And most importantly, it really showed me the importance of how it is up to us to fix things. And this was more shocking when I was able to meet Paul Farmer in person, and when discussing about all the challenges and difficulties of working in global health and working in rural areas, and how the system is so broken and difficult. Being with him and having deep conversations really show me that it is up to us to make the change. It is up to each one of us to change the system. And if we don't do it, then things will continue on as they are, and we would never be able to have universal healthcare for everyone. So since last year, I was struggling really hard after the pandemic and everything that was happening. And when Paul Farmer passed away, I think it just really shook me. And this is what I kept thinking about. It's up to us. And that really motivated me to go deeper into the work that we do and to fight stronger and to work harder and to really take it seriously. That is up to us to change the system.
Thank you, Val. Closeness, proximity to our patients, to communities, to one another has always been central to PIH's work, and it's been a balm in this difficult year. Paul so loved spending time with all of you in Chiapas and had a wonderful, memorable visit there with his daughter, Catherine. Val, you know how proud he was of all that you and the CES team have built there. Speaking of proud, in my 40 years of knowing the Farmer family, it was never clear to me whether Paul was prouder of his siblings or they of him. They are a deeply connected, profoundly loving, and wickedly hilarious crew. Paul's sister Peggy is joining us from her home in North Carolina to represent the Farmer fleet.
On the commemoration of his transition from his earthly coil a year ago, I am reminded of a seminal moment in Haiti in 1987. It was my second trip to Cannes, and with my newly minted degree in anthropology and psychology, I spent the next 6 months living with Père Lafontaine and Momito while PJ traveled back and forth to Harvard Medical School. We had just returned from a site visit in Bois-Joli, where we had been to see a patient who had been critically ill from tuberculosis. And the new budding community health workers program had just started to take hold. The simple yet profound notion that accompanying someone during a life-threatening illness with medication support, food, and fellowship truly turned the tide on TB, AIDS, and other illnesses in rural Haiti. The patient was beginning to improve, and it was joyfully evident that that patient would survive. That night, we were relieved and overjoyed that this beautiful soul would make it through this, and the seeds of the accompaniment model took root. We contemplated the limitless possibilities of the accompaniment model. Patients wouldn't have to walk 5 or 10 or even 15 hours to meet with a community health worker or get to a clinic. We would be able to deploy them throughout all of Haiti. Back then, we weren't thinking scalability, more like survivability, how to evade the Tonton Macoutes so we could buy supplies and bring supplies from Port-au-Prince to Mirebalais and Cannes. Fast forward almost 36 years later, and PIH has grown into a global tree of excellent healthcare delivery. The accompaniment model is now the cornerstone, and global health equity and UGHE are some of the hallmarks of this seminal moment. We are now on the precipice of another seminal moment. We are a world in transition, and there are countless and limitless possibilities that lie before us. I believe that the spirit and vision of his life lives on through each and every one of us. We are deeply committed to infusing and continuing the work of Partners in Health, Global Health Equity, UGHE, and countless other projects around the world. This is a clarion call to make hope, compassion, empathy, and kindness our superpowers. Let us plant gardens of remembrance and water the seeds of hope, limitless possibilities, equity, fairness, compassion, and unity. Dr. Polo, as he was called, always made his patients feel seen, valued, and heard. May we endeavor to make all beings feel safe. May we endeavor to make all beings feel seen, valued, and heard. We are one human family that is inextricably linked, and we are all accompanying one another to better health and a better world. Tout moun, c'est moun. We love and miss you, PJ.
Peggy, thank you. From those first trees you planted in Cannes, which continue to flourish today, you and all the farmers have supported this work in so many ways. True accompaniment. We heed your call for compassion, empathy, and kindness, qualities you have and have shared in abundance. Turning north and east from here to Rwanda, many of you have experienced the roads that connect us to our work, which is often in the most remote areas of each country. Andre literally drove so much of the work and Paul's life in Rwanda, getting him safely to each of those remote locations. Many of those roads were unpaved when he first began traveling with Paul. For those of you who have yet to experience that journey, which is now mostly on beautifully paved roads, we invite you to visit.
Nahuye na Paul Farmer mu mpera za 2005. Icyo gihe Rwinkwavu urumva cyari igihugu kivuye mu ntambara, hari ubukene. Mu bikorwa Paul Farmer yaje ashize imbere, wabonaga yuko ari ukuvura, guhindura ubuzima bwa muntu, gufasha abakene, abatishoboye n'abandi bose batagira kivurira. Ikintu kidasanzwe nabonaga akora ni uburyo ibyo bikorwa yabikoragamo. Yabyikorera ubwe ku giti cye, na n'abo bazanye gukora ako kazi ndetse n'abanyarwanda babafashaga, ntabwo yakoreraga mu bitaro gusa, hageragaho asura abo barwayi mu ngo zabo, akagera ko aho abo bakene agera mu ngo zabo, ajyanye ubufasha butandukanye bw'imirire, imiti, yewe hagera n'aho atangira gufasha no mu buzima busanzwe bwa muntu. Mu bintu yabanje kwigisha mbere abo bakorana, yabanje kubigisha gukunda akazi no kwita ku murwayi no kwita ku byo bashinzwe. Navuga ko abo yakoranye nabo bose bakunze akazi, bakunze umurwayi, bitaye ku barwayi, bitaye ku bakene, bitaye ku bantu bose batagira gikurikirana. Nyuma y'ibyo byose wabonaga ashizeho imbaraga ku bumenyi, akumva yuko ubumenyi bwe yabusangiza bose, ari bwo mu migendere ye, mu byo yaganiraga kenshi, wabonaga ashize imbere ubumenyi, kwigisha, kugira amashuri, kugira icyo amarira isi, kwigisha abaganga, kwigisha abantu mu buzima busanzwe kugira ngo barusheho kugira icyo bakora kizima kuri iyi si. Mu gihe cyose twamaranye namwigiyeho byinshi, namwigiyeho guca bugufi, namwigiyeho gufasha, mwigiraho gufata umuntu nk'uko we uri, kuko ndibuka mu byo yambwiye byinshi nakuyemo bimwe, aho yambwiye ko umuntu nakugana afite ikibazo ubanza ukakigira icyawe, biguha imbaraga zo kumenya uko ushobora kugikemura. Ariko ikindi nacyo namwigiyeho cyane ni uko hamwe n'abantu ushobora kugera kuri byinshi, kuko nta kinanirana umuntu afatikanije n'abandi. Abo yatoje, abo yakoranye nabo bafashe iya mbere gusigasira ibye, gusigasira ibikorwa yatangije, kubifata neza no gukomeza intego yari afite, kandi biragaragara ko yasize abantu bazima barimo gukora akazi neza. Paul Farmer ku giti cyanjye ariho, ibikorwa bye birivugira, kandi n'abo yasize babisigayemo neza, barabisigasiye. Kuri uyu munsi navuga ko Paul Farmer akiriho.
He wanted to share his knowledge with everyone, indeed. Morokoze Andre, for your wonderful accompaniment, support and deep friendship to Paul, and for representing your colleagues at Inshuti Mubuzima and the University of Global Health Equity today. And Morokoze to the many friends who've been part of our work over time, including Melinda Gates, who joins us now from Seattle.
I learned so much from Paul as a teacher and a friend. And I think if I could sum it up in one thing, it would be to see the humanity in every person and put that humanity in that person at the center. The first time I met Paul was in 2003 in Haiti when I visited Kaj, and the walk from the car to the clinic felt like it took forever. And it was because Paul stopped and talked to everyone. He knew their first name. He knew their last name. He asked them questions about their family. I think so often in global health, people think they have the answers, but Paul knew he didn't have the answers. And he knew that he could learn from the community by being there and not only serving them, but I think he taught all of us in global health that we need to accompany people and accompany them on their journey. I grew up Catholic. I believe in something called faith in action. And to me, Paul embodied this. Every single day, he lived out his faith. He knew that disease has a preferential option for the poor, and he was there to make sure that he accompanied people on their health and their life's journey. And that is something I learned from Paul and I will never forget. Lastly, I was lucky enough to visit the campus that was created in Rwanda from his vision and that has been started and will live on long past him. And again, Paul had these big, bold dreams, and he didn't know, or Partners in Health didn't know where the resourcing would come from. But here on the top of this beautiful hill in Rwanda with the breeze blowing through are now future generations of global health leaders and doctors being educated for the continent of Africa. And that is because of Paul's vision and the legacy he leaves behind. So I, like many of you, miss him greatly, but we learn so much, and it's up to all of us to carry on his vision and his life's teachings.
Thank you, Melinda, for your long friendship, for your faith in us, and your faith in a more just future we can all work towards together. Paul and our colleagues in Haiti were so moved when you brought your children there to meet our colleagues and to see the work for yourselves. And now you're cheerleading for Paul's dream of an equity-driven medical school on that beautiful hilltop. In Rwanda, as in Mexico and Navajo Nation and Haiti and everywhere we go, Paul's trainees and mentees are pushing boundaries, making care and systems ever better, delivering the fruits of modern medicine. Paul often noted how much he learned from the clinicians he mentored, and Sriram Shamasunder is no exception. The organization Sri co-founded, the HEAL Initiative, works in partnership with PIH sites in Rwanda, Malawi, Mexico, and Haiti. Paul lives on through this work too.
When I think about Paul, I was looking back at 10 or 12 years of emails, just short correspondences, and we talk a lot about structural violence, and I think Paul embodied a structural tenderness where all the emails are, can't wait to see you, know that you're part of this movement, your family. And so there was just this warm inclusiveness that made us all feel like we are doing exactly what we should be doing, fighting for health equity, fighting for better patient care, fighting against stupid deaths, and we're all part of it together. We're all in it together. And I think he very much embodied that, the structural tenderness, and I try to carry that forward with my students and fellows. The other thing, I was with Paul the last week of his life in Rwanda, and one of the things that sticks out in my mind, he was telling a lot of the Rwandan medical students that when they go see a patient, they shouldn't wear gloves all the time unless there's, a huge risk to them, and to get used to the fact that they might get scabies. And I think that example was another lesson from Paul, is that all of us have to take some risk in order to show that level of tenderness, that structural tenderness, that personal tenderness, that care. And so he was not a real believer of protecting yourself at all costs, but really, how do you accompany, how do you show solidarity, how do you walk hand in hand with our most vulnerable patients? And so I just remember, how many senior doctors would say, you might get scabies, and that's okay. That's part of taking care of poor patients. And I think that he was so clear on that, and he didn't make any apologies for that.
Thank you for sharing those beautiful lessons, Sri, and for your reminder of structural tenderness as essential to this work as a fully stocked pharmacy. Paul always encouraged us to keep our sights on the long view. Our work, as you all know, does not involve magic bullets, and our progress is often measured in decades. In Peru, we met Hilda more than 25 years ago as a leader and community organizer who accompanied families across Caraballo to access healthcare. It's courageous, compassionate work that contributed to radical changes in global policy for the treatment of TB and then HIV.
Desde el primer momento que él llegó, a pesar de que tenía limitaciones con el idioma, o sea, muchas veces se hacía valer de un traductor, pero poco a poco logró comunicarse con los pacientes y también con los líderes de la comunidad, quizás más a través de su expresión corporal. Y eso daba mucho que dar, o sea, la gente le decía, oye, llegó el doctor del pueblo, nuestro médico, ¿no? Entonces, en realidad, para mí, marcó eso, ¿no? Muy importante de que él, la dedicación que daba hacía que era como un doctor en verdad del pueblo, o sea, él no hacía diferencias y quería dar calidad en cada una de las atenciones que daba al paciente. Y bueno, cosas de que siempre me marcó era que cuando él llegaba a Caraballo siempre decía, ya llegué a mi casa, estoy acá, esta es mi casa, ¿no? Siempre lo expresaba y cada vez que venía decía, esta es mi casa, Caraballo es mi casa. Entonces es una de las cosas que realmente a mí me impactó mucho, ¿no? Creo que Paul, o sea, nunca lo olvidaremos mientras seguimos trabajando en este camino de justicia social, de opción preferencial por los más pobres, ¿no?
Gracias, Hilda. A joy to see you again. We'll turn next to your friend Carole Mitnick, a scientist who began working with PIH as a fellow at our Institute for Health and Social Justice soon after its founding in 1994. Carole is a relentless advocate for patients and has dedicated decades of research to our quest for better, more effective and more equitable treatments for tuberculosis. She has also trained generations of scientists to bring all the rigor of their disciplines to the pursuit of justice through research.
I learned countless lessons from Paul over the almost 30 years during which I had the enormous privilege to know and be mentored by him. I learned about the importance of the boîte check given his endless list of things to do to repair the world. I learned to take the work, but not myself, seriously. From Paul and the people he chose to surround himself with, I learned about profound, steady generosity. I gratefully take these lessons with me and try to apply them daily. There's one other lesson I want to highlight. It has impacted my work, my very way of being in the world. Paul taught me to uncover and resist socially constructed choice between equity-advancing options when in fact more than one is possible. I remember traveling with Paul to my first TB Professional Society meeting in 1997. In our Chicago hotel, Paul gently admonished me to look past the false choice between biomedical interventions and those against the underlying social and economic conditions that promote TB. Paul had recommended that I read about the political, social, and economic origins of TB, but I drew the wrong conclusion from that literature. I had thought that the message was to focus on the underlying conditions. I had not considered that I, a non-clinician, could do that and advance access to the highest quality medical care. I learned from this conversation, and those that would follow in the ensuing decades, that PIH and Paul were unique in expecting that we must advance multiple equity priorities simultaneously. This lesson has ongoing relevance. We are confronted with so many false dichotomies entertained by the public health establishment, where I was trained. Prevention versus treatment of HIV, stopping cholera through sanitation measures versus vaccination, healthcare delivery versus research, quantitative versus qualitative research. Paul's wisdom has allowed me to reject these dichotomies and to use my immense privilege to simultaneously work toward improving the conditions in which TB thrives, improving the care available for those living in such conditions, and exposing and remedying inequalities that have led to substandard care. A corollary of this lesson is to resist scoping equity ambitions based on perceived availability of resources. The lesson and its corollary showed me a freedom to push boundaries through research in ways I hadn't imagined possible. It seeded multinational, multidisciplinary research collaborations that undermine the status quo. One exposed that rifampin, a singularly important anti-TB drug, had been underdosed in hundreds of millions of people over 50 years due to perceived cost barriers. Another built on compassionate, comprehensive service platforms to examine 6 novel treatments with potential to improve, shorten, and render more safe care for drug-resistant TB. While recent research by other groups belies a choice between effectiveness and duration, or between expediency and high-quality evidence for new treatments, Paul's influence ensures that we don't sacrifice any of these important attributes in our research. This lesson makes me think of one Paul shared having learned from a patient in Haiti. She described the complexity of which she and others were capable while facing a serious illness, the ability to engage with biomedical care while also pursuing alternative treatments. I remain so grateful for this wisdom and for Paul as I work to increase health and equity in a world designed to deny both.
Thank you, Carole. Your long friendship and that of so many other friends and collaborators is such nourishment in this difficult, necessary work. Our friend Kebba is joining us from his home in Mozambique to share some lessons from Paul learnt in Boston and Malawi and everywhere in between.
Despite the incredible volume of deliberate teaching that Paul did, and that I was the beneficiary of over the course of so many years, when I think about the things that stay with me every day, they're actually lessons that Paul didn't know he was teaching. They were the lessons that I picked up while watching Paul live, while watching Paul engage and interact with the world around him, watching him approach other human beings, always as a humble equal, whether they were Nobel laureates or patients in the village. And the approach of kindness and respect that Paul used when talking to anybody and treating anybody, listening to anybody, is something I aspire to every day. And the shared humanity that Paul had with every human being he came across made it impossible to not fight injustice, made it impossible to not rail against the structural causes of inequity and really just fight for fairness and justice every day of his life. And that is, watching a person live into that reality in every interaction you observe is a profound lesson that is only taught by observation, only taught by example, and is something that I hope we all aspire to, and I will forever hold dear in every waking moment of my life as I aspire to live into what Paul did so naturally and so effortlessly. So many more lessons, but that's one of them that stays with me all the time.
Paul loved everyone, literally everyone, but he saved his greatest care and tenderness for patients. Paul would have been proud to introduce his friend Yabom Koroma as a former patient and a founding member of PIH's Ebola Survivors Program in Sierra Leone. Over to you, Yabom.
I met Paul 2014, where I just come on survive Ebola. I go pay visits to me and my house. At that time, I don't get nothing. So we don't go pay visits to me, we ready for turn back. He give me 200,000. Then I begin start my life small. Then January, he come back. He called for we go for dinner. We go take dinner in Radisson. Some people they intimidate we, but Paul embrace we. Paul na good person, really. And you are not go lie. Paul na change my life. I no be ever know for comot go under sit down per 5 motorcar like denting and he create impact na my life. Then he help me pay for my pikin education. Even me self I do adult education till I don't sit back. And Paul promised me say if I sit worse and I pass, he say he go help me pass standing. But all of the sudden Paul not again. So I don't feel so good. I feel bad, but when I call me say Paul don't die, I don't be expecting he left me this kind of moment. So Paul, let God bless outside there. Let God make all the goodness we do not go in vain. Let God sorry for her. We say full left, the left, so pray for him, let God help am sign there. Paul na good person. He make me meet with me company. He make me able mingle with me company. He even make book with me, write book with me. After I don't can give me the book, I promise me say the can the next year. All of the sudden I hear and I wonder, they say the car Wednesday. Monday morning they call me say Paul don't die. So and they only do he look disappointed. I'll tell God thank you. The guy with the so now. With the pray now don't left. They God make una no left free so. They God make una still remember we una still remember Paul. So then in my own prayer, I'm your own thank you.
Thank you, Yabom. What a moving testament. I remember well the day we stood in the street outside your home, sharing gratitude for your survival, mourning your losses, and embarking on a friendship that will bind us together always. Our friend, US Representative Jan Schakowsky, has introduced the Paul Farmer Memorial Resolution in Congress. It's a beautiful way of codifying Paul's vision of equitable, excellent care everywhere into the laws of our country. What a powerful advocate she is and has been. Paul adored you, Jan, and he was so grateful to know we could count on you.
I first met my precious friend, Paul Farmer, in Haiti, in Cange. And I had taken a bumpy road up to Cange in a place that had not had health care, that needed health care, where it was essentially a state-of-the-art clinic, because Paul believed that every single person deserved the kind of health care that the best of us, the richest of us, should be able to get. Every person. And what really moved me is that there was a boy who was dying, and Paul sat next to him and stroked him and talked to him and waited until that boy passed away. I thought, what a beautiful person, because he cared about that one individual. But he has turned that into almost a miracle for millions of people around the globe, because of the steadfast belief that everyone deserved equal treatment. I have tried to adopt that as a role model in my life as a member of Congress. And I have to tell you that my heart still breaks every time I think that Paul Farmer is no longer in the world. But he has trained students, he has inspired people everywhere to follow in his footsteps, and the kinds of changes that have been and will be made thanks to Paul Farmer. He will always be in my heart, and he will always be in my mind, pushing me to do better, to work harder, and to be optimistic, and to make jokes. I loved him so. I still love him. Thanks for letting me talk about my dear, dear friend, Paul.
Paul often reminded us that the hardest, most important work should be done with people you love. Paul and Bryan Stevenson loved each other through difficult and hopeful times, building extraordinary organizations and movements in the face of sometimes devastating odds. They shared their triumphs too, and served as a constant source of inspiration to one another and to all of us.
Paul and I would routinely get together and have a meal. He would usually be flying off to Africa or to Haiti or to Miami, and I'd be on my way somewhere. But it wouldn't take us long to fall into this beautiful, intimate space that Paul seemed to create for the people he loved and cared about so easily. And one of the many things I loved about Paul is that we could talk about things that you don't usually talk about with other people. And he would ask me these uniquely Paul Farmer questions. And one of the last times I saw him, he asked me, Bryan, do you believe in angels? And I told him a story. I told him about how I argued this case at the Supreme Court, and it had turned into a win for children who had been sentenced to life imprisonment without parole in this country. And I was occasionally going places. I would frequently go places, and I'd meet someone who said I was condemned to die in prison as a child, but through the case, I've gotten my sentence overturned and now I've been released and I'm one of your guys. And these young people would hug me and it would be so beautiful. But I explained to Paul that when I was arguing the case of one of the people impacted by this decision, the judge didn't grant the kind of sentence, the relief that we were looking for, and reimposed a very lengthy sentence. And it just broke my heart. And later in the day, when that young man called me, I was trying to apologize that things hadn't gone the way I wanted them to, and I was getting emotional. And it wasn't appropriate, but that's what happened. And before I knew it, it was my client who'd been sentenced to die in prison at 14 who was saying to me, "Hey, Bryan, don't worry about it. It's just okay. It's all right. I know you're going to get me out one day. Don't cry." And that made me feel worse because I didn't feel like it should be his role to comfort me. And I finished the call and I just didn't feel good the rest of the day. And I remember heading home that night and stopping in some eatery to get some food to take home, some soup or something. And when I walked into the restaurant, there was this group of 5 older Black women sitting at a table. And they recognized me when I walked in, and one of them waved at me. And I waved back and I got my food and I was about to leave when one of the older women said, "Hey, come over here." And there were other people in the restaurant, so I was a little embarrassed. And so I just stood there. She said, "Hey, come over here." And so I went over, and I went over to this older woman, and she said, "Bend down." And I didn't quite understand. And she said it again. She said, "Bend down." And I bent down. And when I bent down, she leaned up and she kissed me on the forehead. She said, "You keep on keeping on." And I just stood there amazed. And she said, go home, eat your food, go home." And when I got in my car, I smiled and I think I shed a tear. And then I felt uplifted. And I told Paul that story and I told him that I think that woman was an angel. I do believe that there are people who we encounter who have an almost mystical ability to say the things we need to say to have an impact. Paul and I finished our conversation and it was time to say goodbye. And I didn't appreciate that it would want to be one of our last goodbyes. But as we stood to hug to leave, I said, "Paul, you keep on keeping on." And I thought he would laugh, but Paul just hugged me tighter. And when I stood back, I saw that he had a tear in his eye. And he said, "No, you keep on keeping on." And it moved me. And because this was the nature of our relationship, I said, "No, you keep on keeping on." And he said, "No, you keep on keeping on." And like 2 teenagers, we left each other childishly trying to figure out who was going to say "keep on keeping on" last. And because he was my older, beloved brother, I gave him that space and we left. And I remember that. And I think that Paul Farmer was an angel, not in that moral way that we sometimes think about it, but in that way of being someone who could come into your life, say things that touched you and moved you, open up your heart to the possibility of healing and love and doing things that are necessary. And what I love about Paul is that his life is the kind of life that even from the grave has the power to say to each and every one of us that we have to keep on keeping on, that we have to fight for the poor, we have to fight for the condemned, we have to fight for the sick and the marginalized, we have to do something about the excluded. That work can never end until we lift up justice and healing in the way that his whole life was about. And so I love Paul because he reinforced for me the power of keeping on, keeping on. And that's what I'm carrying with me as I think about him and his extraordinary life.
Keep on keeping on. Keep on keeping on. I'm gonna keep on keeping on. Keep on keeping on. Left foot forward, right foot next. shoulder straight, body taller. This ain't the time to rest. Exercise your rights while you got 'em. No time to waste. Each moment matters in this here race. You gotta just keep on keeping on. Well, you keep on keeping on. Well, we'll keep on keeping on. We're gonna keep on keeping on. I took the road less traveled. Keep on keeping Feared I went too far. Keep on keeping Started to unravel. Yeah, it got so hard. But I kept on in that direction. The ferry dissipates. My people lift me up. A movement we create. That's how we keep on keeping on. 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 When the weight of the world is on your shoulders and it all seems to get you down, and it's hard when you wanna be bolder, but the elements keep knocking you around. You plant your feet firmly in the ground. Remember, life is sweet and even often so profound. You're making memories, not idle reveries. Be a queen and then will come the crown. Keep on, where we're gonna keep on keeping on. Keep on keeping on. Keep on keeping on. Keeping on. Keep on keeping on. Well, we'll keep on keeping on. We'll keep on keeping on. We'll keep on. Keep on keeping on. Keep on keeping on. We're gonna keep on keeping on. Keep on keeping on. Yeah, we'll keep on. 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 Keep on. We'll keep on. We'll keep on. We'll keep on. Keep on. Yeah, we'll keep on keeping on.
Thank you so much to Silkroad Ensemble for your beautiful accompaniment of music today. Also, thank you to all of you who shared your personal reflections of Paul. This is just a glimpse into the impact that Paul had on so many people around the world. Today, we pause as a community to collectively reflect on the loss of Paul a year ago, and also to take time to remember the impact he had on all of us. But we think about Paul every day. Our community health workers who are climbing mountains in Haiti to get to those in most need think about Paul every day. Our young Pasante physicians in Chiapas, Mexico, who work in very rural communities as the only healthcare provider, also think about Paul. Our drivers who are driving our patients and our staff around also think about Paul. Me, as a leader of this amazing organization, often draw on the strengths and the lessons I learned from Paul as we look at navigating this very complicated world and this tension between doing what we know is needed most for those in front of us, but also thinking strategically about the future and what we need to do to ensure that we're developing the next generation of those who will take on this battle for global health equity. Paul shows up in us, all of us, every day. Paul was a visionary who truly believed that one person was the same as the next person, and that really we needed to ensure that everybody is treated with the utmost respect and dignity and deserving of the highest quality of healthcare That's why all of us are here today. Paul built this amazing community of people, those in the 11 countries that PIH works, and many, many other places in the world which have been influenced by Paul and his unrelenting vision to care for those who needed it most. As this past year has been very difficult, our thoughts and prayers continue to be with Didi, the children, his mom, and his family, and know that they have been impacted the most, but also with each other as we all continue to live in this world without Paul. I find solace in the fact that I know we're continuing to do this amazing work, and we're continuing to be driven by Paul and what he laid out in front of us and the importance of what we need to do to bring global health equity around the world. As we heard the amazing Bryan Stevenson say, we will continue to keep on keeping on. That's what Paul would have wanted, and that's our best way that we can honor this amazing man who we will continue to grieve about on a daily basis, but who will continue to drive us to move forward and drive us to do the best we can for those who deserve it most.
Thank you, Sheila, for your leadership, your constance, your steadfast focus on our patients and our colleagues. And thanks to all who joined us today to share your tributes to Paul, and the many of you who've come to join in this time of solidarity and remembrance. We're grateful for this beloved community every day, particularly today. Paul loved you all so much. He loved this work so very much, and he loved to have the last word. Here you go, PJ.
Eh bien, allez, mes amis. Merci bien. Merci, mon ami. Bien content de nous. Merci pour l'accueil là.
Merci, Polo.
Ok, chérie. Bye.